Morning. Child immunization rates are raising major concerns for leaders in the Tennessee Health Department. The report shows the rates remain below pre-pandemic levels, putting communities at risk. Nicole Smith joins us now to explain what's happening.
Hey, Nikki, this is World Immunization Week, and the health department is trying to get the message out that young children need these vaccines to help keep decades-old diseases from spreading in the community. The health department released its 2021 immunization status survey of 24-month-old children in Tennessee. It says historically, Tennessee's vaccination rates have remained relatively high, but have not achieved the federal metric called the Healthy People Objectives. In 2021, Tennessee met 2 out of the 12 HP 2020 objectives and none out of the 3 HP 2030 objectives. Tennessee ranks in the bottom 20% of states for the completion of 7 vaccine series, ranking 41st in the nation. The health department found the COVID-19 pandemic has had a considerable negative impact on the vaccination rate of children in Tennessee. Vaccination rates between 2020 and 2021 increased overall, but the difference between rates in 2019 and the rates in 2021 during the height of the pandemic are cause for concern. The pandemic caused a lot of children to fall behind in their routine childhood immunizations, and the report shows that, unfortunately, catch-up vaccinations are not happening. I talked with Dr. Paul Peterson, who is the interim director of the Vaccine Preventable Diseases and Immunization Program in the health department. He says they're working with healthcare providers to send reminders out to families with children who are not fully vaccinated for their age.
We are giving them the tools so they can bring those children and their families back in so they can get the vaccines that they need that really are important, because if we have a under-vaccinated population, there is a risk of these diseases to start outbreaks and things that we haven't seen for decades. And so that's why it's really critical that these children have the opportunity to be vaccinated.
The report shows there is approximately a 5-fold increase in the number of children that have received no doses of recommended vaccines in 2021. Neil.